Okay, guys, welcome back. So this was on day 7, Saturday morning. I have nothing else to do. Two kids at home, a wife that needs help. But I got a toothache, so I'm going to go in the office and I'm going to try to troubleshoot this myself. Granted, the entire week I was trying to figure out what the heck was going on. So up to this point, my thought was, like we talked about earlier, irritation of the mucosa from the intubation, rising up of the tooth, causing pulpitis. I really didn't think that it was irreversible pulpitis, but honestly, when you're in that much pain, you're going to ignore this. Well, I guess that's why doctors shouldn't treat themselves. Anyways, I had the help of some really good doctors, and we all came to the same conclusion. Pulpectomy is what was needed. I mean, it really was screaming spontaneous pain, waking me up at night. Ibuprofen was helping. So as you can see, the pulpectomy was completed the day before this image was taken. You can see the calcium hydroxide that's in there. The nerve was completely removed. Working lengths were achieved, brought to a number 15 file. For all intents and purposes, if the pain was coming from the inside of the tooth, one would think that the pain would have changed after the root canal. Unfortunately, after the anesthetic wore off, the pain came back. So literally, the entire time, we're focusing on odontogenic etiologies. At this point, I'm starting to think it's something with the PDL. And I kind of had that thought initially because of the fact that this root tip on certain images does poke through the lingual plate. So I thought the PDL inflammation induced by the intubation was a potential source of it. So I went into the office and I got I'm in a mirror. I got a perio probe down here and I'm measuring, there's a good 9mm pocket here. Now keep in mind, this whole area is inflamed. So is it 9mm or is it a 9mm pocket composed of a pseudo pocket component, meaning the inflamed tissue was giving me a reading that was somewhat false. With that said, when this is all said and done, I'm going to have one of the doctors basically remove this. We need more crown height anyways for the crown that needs to go on this. This torus is just causing issues. Matter of fact, I might have whoever the doctor is do an entire removal of the tori. I have airway problems, and I have no doubt it's because I have so much bone pushing my tongue out of the oral vault. With that said, I need to get this resolved first. So, it's not coming from inside the nerve. Everything I've had done up to this point, after the anesthetic wore off, was painful. So I take a probe, I'm probing down here, and it's bleeding a little bit, not too bad. The pain's not really replicating the pain I have when I'm kind of waning off of the ibuprofen. But then I take the probe, and this area right here is what hurts. So I take the probe, I feel over here. This is tender, but in hindsight, it's only tender because this is tender. This is just kind of the innocent bystander. The pain's coming from right here. So I take the probe and I'm coming down, and all of a sudden I feel a piece of bone here. And I'm like, you've got to be kidding me. I have a bony sequestra, which in the back of my mind I was thinking could be a possibility down the road because I've seen that before. And we've had a couple patients in the office who had intubation for general anesthesia that came to the office with similar situations. But let's just take a look at right there. So that wasn't there before. I'm going to turn the video off because the kids are home. But let's just make a note of that.